Hi, this is Mike from Insect Shield, and I am with Monica White, the founder of the Colorado Tick-Borne Disease Awareness Association. Can be found at coloradoticks.org. A little simpler. Welcome, Monica.
Thank you. Thanks for having me.
Absolutely. So I guess we always just want to start out with your story, your background, kind of what you did, kind of pre getting involved, and kind of why you got involved with Lyme disease and tick-borne disease work.
Yeah. So I was born and raised on the East Coast and, spent my life in the woods, camping and fishing and hiking and, literally rolling around in the grass and the leaves. And went and got my education in New Hampshire as well, my further education as a wildlife biologist. And then I moved to beautiful Colorado and really didn't know much about ticks, didn't know much about tick-borne disease. I think I had heard about Lyme once my entire time growing up on the East Coast. And then I got sick after the birth of my second child. So I was working out in Colorado as a wildlife biologist and was under a lot of stress and started developing some really crazy symptoms, going doctor to doctor, not being able to figure out what was going on. My son, who was a newborn at the time, was also experiencing a lot of strange symptoms. And then in retrospect, my first child had as well. But without any knowledge or background, it took 7.5 years to get an accurate diagnosis of Lyme and multiple tick-borne infections. Even though I had been a wildlife biologist my entire career, I had lived and worked in the woods as a wildland firefighter. I'd camped with no tents. I had traveled the country, many endemic states. Even with that information, couldn't get a doctor to even test me for Lyme. Didn't even think about Lyme. So 7.5 years into what became debilitating illness, I finally did get an accurate diagnosis and started on the journey of treatment. And at that time, I decided, as soon as I'm better, we've got to provide the resources that were not available to us. I worked for a federal agency as an outdoor worker, and not once did we get any education on prevention, risk of tick bite.
I mean, have you been bitten by ticks before? And was there any instruction of how to remove them, or just?
Oh, yeah, I've been bitten by ticks many times.
You were burning them off and putting Vaseline, probably.
Vaseline, the matches, you name it. All the things you're not supposed to do to remove a tick is how ticks were removed when I was younger. I had also gotten really sick in college with an unidentified illness in retrospect. Like it was classic Lyme, Babesia, anaplasmosis. But I was tested for everything but tick-borne diseases at the time. Several months later, I recouped my energy. I seemed to be okay. And I went on with my life until the birth of my second child. And so I think just that additional stressor and other stressors is what, and another tick bite right before I got pregnant. Was what kind of triggered the cascade of the illness for me. So yeah, no knowledge, prevention was unknown. Even as a wildlife biologist, had no idea of the number of illnesses that could, manifest after a tick bite. And so I really, really wanted to provide the resources that weren't here for us in Colorado. We're in a state where Lyme is not considered endemic by the state of Colorado, by the CDC. So it's a hard sell to push prevention when acknowledgement of even, some of the more common diseases we have in Colorado aren't, really considered a high risk. So I had my work.
So you decided, so you just seems like you're obviously, educating and studying, and I mean, and to be a wildlife biologist, I imagine it's there's a lot of curiosity and just in the world and life. So you're, instead of just having a group like, oh, I want to meet other people that have like Lyme and I can maybe learn from them and talk to them, you're like, no, I want to go more like, let's help people and be the leader. Because I mean, even just to find groups, could you find other people in Colorado, or did you find them once you put it out there? Once you started this, did you then find a community locally?
It seems like as soon as I started putting it out there, a couple of other people in Colorado were putting it out there at the same time. Like Live Lyme found it about the same time we did, with common interests and different missions.
Right.
So I really believe like the more we put out there, the more things started to happen. Even with reporting of Lyme. Lyme is a reportable disease in Colorado, and yet the state will say that none of those reported cases have generated out of Colorado, so they are all travel related.
Right.
But what I did notice over time with that reporting is that as soon as we established, like there hadn't been a reported case of Lyme in over a decade, as soon as we established, then there was a case, then there were a couple of cases. And in 2019, like we had a record high for Colorado, even if they all came from travel, of 8 cases. So like over time, I think just more awareness, the more people knew what to look for, whether they were getting sick endemically or through travel, and more cases are getting reported. So I think just that general awareness is helping people get to help faster.
Right. Well, because I mean, you hear so many stories of, people just think they have, like you. I mean, what's wrong with me? And if you're somewhere that there's no conversation about ticks, it goes on and on. But then at least if someone's like, maybe there's a tick, and then maybe if you can find a Lyme literate doctor that can and the testing.
Right. I had no idea what a Lyme literate doctor was when I got sick. Didn't know about the pitfalls of testing. The information that I sought out from reputable places convinced me I did not have Lyme because the symptoms didn't match what patients are experiencing in the bigger picture. And so like it was a hard living in a low incidence or no incidence state for that specific disease. It was a very hard path to get to somebody that could help. And we just, my whole family was ill with Lyme. And we really just didn't want another individual or another family or another child to go years and years and years without a diagnosis or without the resources to make decisions that are important to make. The earlier in the illness, the better.
Right, sure. Now, what year did you start the association?
We established in 2016 as a nonprofit. I had done some things privately prior to that. Just because like, as soon as I started feeling human again, I just couldn't like contain myself. I'm like, everybody needs to know how to protect themselves. They need to know how to prevent a tick bite. They need to know that there's more than one kind of tick on, in Colorado, in this country, throughout the world. They need to know it's more than Lyme disease. I mean, the number of pathogens that we are aware that can be transmitted, are almost at 20.
Yeah.
So just really curious too about when we were building our webpage, what did we know about ticks in Colorado? And the more I started researching, I couldn't find the references for this list that had been produced. And so I dug, my research brain just kept digging and digging and digging, and found my way to an incredibly passionate person, used to work for USDA, Dr. Joel Hutchison. And he was just as interested in figuring out what we had in Colorado through records and specimens and previous studies. And so we gathered a little team, and with their professionalism and my curiosity and research abilities, we were able to publish on ticks and tick-borne diseases in Colorado as kind of a baseline of what has been found here, not just the tick species, but the pathogens that we know have been detected in either ticks or small mammals.
And that's actually, because I found that, and we've been working together, obviously, with Insect Shield, but I saw that, I mean, to actually then have gone and you've published a paper, and what journal was it actually published in?
Journal of Medical Entomology.
Yeah.
Yeah.
So that's pretty amazing to go from, okay, just, I mean, so the trajectory of life changing, but that also you already have the background of being like probably doing this, but you just hadn't done it like for ticks. You're doing it for other,
Yeah. Never in my wildest dreams did I ever think I would be interested in ticks the way I have become.
They're pretty, I mean, I've gotten more, they're pretty fascinating. That's just really how they maneuver and what they do. And unfortunately all the pathogens they can carry. So the group, so that paper was published. Did that kind of bring some more attention to you and into Colorado, or?
I know we have had a little bit more research generated in Colorado. I'm not going to say it was due to our publication.
Yeah.
I think interested parties in the right place at the right time has definitely helped. And we kind of are a black hole here. Like there were studies done in the early 90s, and there was information gathered back then, but then there's this huge gap of research knowledge that's just kind of developed, and I think it's starting to come back. So, and I do understand that the states that are dealing with, high levels of Lyme disease, and the research dollars going to states that have that known prevalence. The problem is a lot of the information about Colorado is kind of based on lack of data.
Right.
Not that there's that it isn't there. It's just it hasn't been collected.
Right.
So a lot of statements made with no data to support.
Right.
So,
well, at least I guess now, if someone is like they're in Colorado and they're just like, oh, I got a tick, is there something? Even just Googling, if you type in Colorado and ticks, you can come. You get to someone like you and say, okay, there is something happening here, and I should. Think about maybe saying to my doctor, there was a tick, that I ran across.
Absolutely.
That type of thing.
Absolutely. Yeah.
And then the other thing, so obviously then the research and trying to just bring attention to Colorado, but then I believe you work just kind of more on the national level of just legislative, trying to advocate for people with Lyme disease and tick-borne disease. And we were discussing before just, is like, getting it like in workman's comp and insurance to help, that type of thing. So I think you do some work with the national groups as well.
Yeah, I've tried to advocate at a national level wherever my voice seems appropriate. So for the tick-borne disease working group that HHS had over the past 6 years, I was on a subcommittee group for 2 of those panels over the 6 years, so 4 years out of the 6 years. I've been participating with Centers for Lyme Action with their DC fly-in, urging for more research dollars into Lyme and other tick-borne diseases. And all I can say is, as soon as advocates started using their voices there at a national level, those dollars started to increase. And I've seen things happening. The more those voices get elevated, do I wish it were faster? Yes. But to see progress is amazing.
Yeah.
Because the truth of the matter is our family was devastated.
How was your family? You have 2 boys?
I have a boy and a girl.
Okay. And how are they okay now? Or is
we are still battling in some arenas there.
Right.
Even, with a 19-year-old and a 17-year-old.
Yeah.
So my son and I were more susceptible. My husband and daughter responded better to treatment. So there's been, relapse and retreatment for everybody but my husband, actually. So he did really well with his initial treatment. But to discover our entire family was ill after so many years of trying to figure out, like, literally putting out spot fires, and not understanding how it all connected until, complete strangers were saying, "Have you been tested for Lyme?" And I'm like, "What?"
No, I was talking to some other you say, like, oh yeah, someone at like the gas station like mentioned it to me, like, and like there was this word out there, and then a lot of times they go to the doctor, and there's still obviously there's no acknowledgement. There was a boy in Pennsylvania who had Powassan this last summer, and I actually spoke to his mom, and she saw the tick, she collected the tick, she took the tick to the doctor, to the hospital, and they were like, "It's not the tick." And then so it took them another 2 weeks, and luckily they did diagnose him, but they had immediately, so just the discounting has got to be tough. So within your group now, what are you all, so you've got, do you have meetings now? I mean, COVID, I know, kind of blocked a lot of stuff for people for a couple of years. Are you able to gather?
We are just getting back to some in person. I did one week. I mean, I used to spend my time going and talking to all the government outdoor agencies, safety and prevention for employees. And it really did ramp up the awareness, especially for firefighters and other field going folks in our region, which was great. With COVID, of course, we didn't get to do the in-person as much. So we're just starting back this year. We're going to have some pretty exciting activities coming up in May, beginning in May, that I'm not sure I can announce yet.
Okay.
But I will soon. But I will soon.
Yep.
But we partnered with Colorado Lyme and Tick-Borne Disease Support Group. So on a monthly to bi-monthly basis, we either host open forums where patients can just get together and find support and share information, or we're hosting guest speakers or even activities. We have a yoga for chronically ill, those that aren't very mobile, coming up on Sunday. So we do a lot of patient support. Prevention is huge. Getting into the schools, partnered with
the prevention's key. And one thing I've been talking with some other, because there's so many great groups and support, but then it seems like some of them, they kind of, the prevention side of it just gets kind of not mentioned, and not where, like, obviously you don't want to get rebitten, if you get, or sometimes some people you get bitten again, and that's not always a conversation. So I think with you all really trying to be about awareness and education, and also, of course, helping people that are ill and how maybe some ideas on how they can feel better, but then also saying, how do we not get bitten? How do I not get rebitten? And that's where sometimes it's like we got that part of the message, because it's we were talking before. You go to the vet, and the first thing they ask is, what type of flea and tick prevention is your dog on? And if they're not on any, you're just like, you're a bad pet parent. And yet, you're not going to, kids are going to school, or say the kids to school. I mean, you're in Colorado, they're probably going on camping trips, or, all over, or in New Hampshire where you were, it's, and not having, like, thinking, how are we going to,
and no joke, I was that mom that brought all of the information about ticks to the sleepover camp here in our local area when my children were in 5th grade, and nobody wanted to see it.
Right.
And then my daughter was the first child that I had to remove a tick from, and it wasn't embedded, it was in her clothing. But the cabin I was staying in, I made sure that all of the children turned their clothes inside out, tick checked each other, showered, and then we took turns going through hair. And I know I was probably considered, the crazy mom, but I don't know how it was my daughter that had the first tick, but just the way things go.
Right.
But then, 10 more children on that same trip had ticks and maybe didn't get the same level of precaution as the cabin that I stayed in.
Right.
I feel like that kind of information is starting to be received a lot better than it was 10 years ago.
Right.
So, that's a priority for us. Like just making sure people have the information, know what to look for, know what their tools are, because there are a lot of choices, and I know people have very strong feelings about what they do put on them or don't put on them, or put on their pets or don't put on their pets, and just knowing all of the options available to help prevent the tick bite, because that's key. It's just absolutely key to staying well.
Right. And it's not that unfortunate, and it's not that hard to do. I mean, they're everywhere, and you've met people miss them, but it can be done if there's just a little bit of consciousness, a little bit of change. Yep. And I was talking with another person about it too. It's like sun protection, 15 years ago, like none of it, that was not a huge priority often. And then now it's, gosh forbid, you don't have your sunscreen. So hopefully with, folks like you and other people, it's like, okay, that just becomes, an everyday thing. And I've got deer. I live in like the suburbs, but like they're deer in the yards and running around. We wake up to like, it's a deer. And you're like, and so even just out in the yard, it's not just you're adventuring out into like the wilderness, I think is, a key message too for folks.
Yeah. I look at small mammals with a whole different light now than I used to. And with the children, like I've been very lucky, in my local community. Our public health department is very proactive. And so we have worked together on campaigns for getting this education into the schools and bringing it into the community. And I know I'm very lucky that way. Colorado's a big state, so I'm hoping to develop some of those relationships at a larger level too, because, even if our risk is lower here, it doesn't matter, because one tick bite matters and people travel.
Well, I was going to say, that's the thing. I mean, in America, that's one of the things, we like to go places. So it's like, there may be most cases from somewhere else, but most people go go some trip from the summer or the winter, they go in places. So as long if they come home and maybe there aren't, these many ticks in Colorado, but there has to be support, because if you get it, you go back home and then you're dealing with a doctor. You need to have that they know what they're managing. So, I mean,
and we do have, from the study that we did, we have 28 different species of ticks in Colorado, and a large percentage of them are of either veterinary or medical significance, like they're important.
Yeah.
So it isn't just Lyme. It's a lot of other diseases that can be just as debilitating or more debilitating, especially if not, caught and treated quickly.
Yeah.
So, tick prevention, regardless of what tick, it's just a message that needs to be at a national level and not even at a state by state level.
I mean, it's unfortunate, but I think like alpha-gal, which just for, creates the meat allergy and a lot of digestive issues. And, that often gets, when we tell people that, a tick bite could maybe make you allergic to red meat or to meat, and some folks, I mean, their eyes open, because there's some, that would be a big change to my life. Not considering, of course, with Lyme and other things where you can maybe, be debilitated and not walk and have other, really bad, but something like that for some folks, it's like that could just, if it can turn that light bulb, like, oh, I don't want that. It's like, well, you don't want any of them, but if that's one that people can almost relate to, because there's about, food is just such a, part of, the enjoyance of life. So it gets, and I know one thing with that group too, is that really can get re-triggered by another bite. So they're the prevention side too. And I think that's where, if folks just take some simple precautions, and people like you just saying, like, just so, and check yourself and learn how to remove a tick and send a picture into
proper removal
and sending a picture, making sure you know what it is. And then, do you have to worry or do you not, and how to go to the doctor? I mean, I've learned so much from so many people about what you do, because it, doesn't have to be debilitating. And unfortunately, there's folks like you who, your life was dramatically impacted.
Yeah. And mostly due to, this cyclic argument that I can't have Lyme because I live in Colorado.
Right.
Well, I have Lyme and multiple other diseases, and I didn't always live in Colorado, and I traveled, and so do a lot of other people.
Right. I mean, Lyme's been, it's been found in every state.
So, and it is in, a cousin to the black-legged tick here in Colorado. Different species of Borrelia are here in Colorado. Right. And that's just, another awareness piece. And even working, we have a partnership with the Bird Conservancy of the Rockies. So they are trapping birds, breeding birds as they go through the state in fall, spring. And we've been having them send us the ticks that they collect off of the birds each year, just to track, what we might be having come through, if we have anything coming through. And
I don't think a lot of people realize that birds carry, and then also that's where some of the migration of some of these tick-borne diseases, because a bird could get the tick in another state because birds travel too. So
right, exactly.
That birds are actually a big part of movement of ticks.
Yep. So
so you're working on more, like, are you doing any other research papers like that? So you worked in that group. Is that something you all just are studying?
I'm not working on any research papers right now. Right now, we are working on a giant awareness campaign for this year, and so we're hoping to make a big impact on a statewide level.
That's great. I hope we can continue. Insect Shield will be happy to support your efforts, because
I'm excited
that's part. It's we make a product that works, so we have a business, but it's like, to know that there's what we can offer people and what they can use can really help, and they can go enjoy outside, enjoy nature, and and really feel protected.
Absolutely, and it's a part of our daily routine. I mean, we have our boots are sprayed and our packs are sprayed, and every season I'm either buying new pre-sprayed clothes or re-spraying the ones we have. Right. And it's another level of protection, because the last thing any of us need is another pathogen to contend with. And we are seeing movement. We have occurrence of the Lone Star tick in Colorado, which hadn't historically been here. Not sure if they're an established population, but they're on the map for the state right now. So, it's just another level of awareness, and ticks are moving, pathogens are being discovered.
Yeah, and when one tick lays its bundle of eggs, it's thousands. So the ticks can, the population, there's no worrying of the tick population decreasing like there are for a lot of countries of people. Like, wow, there's one tick makes a lot of ticks. So
and having been a wildlife biologist my entire career, I was in Colorado the majority of my adulthood. There was only one part of Colorado where I had run into ticks a lot when I was younger in my career. And then there was a pretty good stretch where I really didn't run into ticks until I got sick. And then it's like they just came out of the woodwork. And I was hearing from long-term, employees of the U.S. Forest Service where I worked that I never saw a tick in 20 years, and now they're everywhere. And I know that's not very scientific, but when you have people that are in the same location,
anecdotally, things it adds. I mean, if 10 people, or the more people are saying something, there's I can't recall the phrase, but if there's something there, it's like, okay, there's something there, because you wouldn't, it just doesn't occur like that. Well, that's great. No, we're really happy to support you and just learn more about all of your efforts. And it's just so interesting because how, this, a horrible thing and your whole family being affected. But then, it changes the path of your life besides health wise, but education wise, I'm sure people you've met, government advocacy. It's really, it's great that like you could take that and then say, okay, I'm going to help the next group that comes along and hope they don't go through what I went through. Because I think too many people sit back, oh, well, it's, they don't do anything, but it's so exciting refreshing to say, okay, no, you're like, let's do something to make this better.
Absolutely.
It's got to feel
good. And like Insect Shield has been, supporting our efforts from the very beginning. And just like to know that we have these resources to be able to share and keep people protected is just huge. And moms, especially moms, Mothers Against Lyme. I'm a part of that organization as well now. And just, that conversation starter, just because you have one thing doesn't mean you can't get another, or that there may not be risk from mom to child too.
Right.
So,
yes. That's interesting.
Yeah.
Whole
another podcast.
Yeah, exactly. No, exactly. That was well. Well, thank you so much for your time. Really appreciate hearing about what you're doing and all the good you're doing in Colorado for the community and for the the nation too, because all the work hopefully spreads out and more resources come to prevention. Because if you look at the number, there's more money coming in, but it's not that much money when you look at how money that's gone to other other ailments and just other diseases. So it's
not equivalent to other diseases, but to at least see the upward trend continue is hopeful. So
absolutely.
Thank you so much for having me.
Thank you. Really appreciate it.
Yeah.
Okay.